To the Summerly Dental YouTube channel. On today's episode, I'm going to briefly go over some important post-op instructions after having a tooth removed. These are the specific instructions that we give to our patients here at Summerly Dental. However, these instructions are pretty general and they should be fine for most extractions. Every extraction case is a little bit different, so we will modify these instructions for that specific patient if need be. The most important thing after an extraction is to promote good clot formation. The best way to do that is to apply pressure to the extraction site. We usually give our patients a 2x2 piece of gauze and ask them to fold it 2 or 3 times. Stick it where the tooth was taken out and bite down. It's important to keep firm pressure on that and not to talk or move your jaw too much. The second most important thing we recommend to patients is to put ice on the side where the tooth was taken out for 15 minutes on, 15 minutes off. If we're doing multiple extractions or wisdom teeth, for example, we recommend that you alternate 15 minutes on one side and 15 minutes on the other side. Ice is going to be one of the best ways to prevent pain and swelling. It's important that the ice is placed immediately, and so at least in our clinic, we will give the patients the ice packs in office so they can start on that right away. Once a patient leaves our office, biting on gauze and with the ice pack, we recommend that they check the site every 15 to 20 minutes. If there's still a little bit of bleeding, we do recommend to take out the gauze and put a new one in and bite down again for that 15 to 20 minutes. As soon as the bleeding is well controlled, you can stop doing that. Keep in mind that when we do take out teeth, we are using an anesthetic that has epinephrine. That epinephrine is actually constricting the blood vessels and helping to control bleeding. Sometimes when that freezing wears out, you might get a little bit of rebound bleeding. That's completely normal. Just go ahead and grab another piece of gauze, fold it a few times and bite on that. It should stop pretty quickly. Also, don't be alarmed if you wake up and there's some streaking of blood on your pillow or on your blanket. That is normal. Typically, it's going to be a lighter colored blood since it is mixing with your saliva. If you're unsure, call your dentist. There are certain circumstances where the bleeding does take a longer time to clot. If that's the case, you can try biting on a tea bag. Tea bags, specifically black tea, have what's called tannic acid, which will help to clot that blood even further. Basically, you take the tea bag, you moistened it, and you can bite on that. 24 hours, you want to avoid the area as best as possible. In general, you're going to want to stick to softer foods and avoid anything with small seeds, such as strawberries or popcorn. Anything that can get stuck in that extraction site is just going to slow down the healing and increase your risk for infection. We do provide our patients with a Monoject syringe. We recommend filling this with warm salt water if you do need to gently irrigate or rinse the area. You don't want to go too aggressively, and you also don't want to stick the tip in the extraction site, as you may wash out the blood clot. 24 hours after your extraction, I do recommend that my patients start rinsing their mouth with warm salt water. You want to be really gentle when you do this, and for a lot of patients, we don't recommend swishing aggressively and just moving your head back and forth to allow the solution to move around. If you're not comfortable rinsing, you can again resort to that syringe. Just fill it with warm salt water and gently irrigate the area where the tooth was taken out. Dry socket is a condition whereby the blood clot can be dislodged from the socket, creating a very painful situation that may need further intervention and or antibiotics. It's extremely important to try to prevent this in the first place. The number one reason a patient would get a dry socket is if they smoke within the first 2 to 3 days of the extraction. You also want to avoid drinking through straws and be really gentle if you have to cough or sneeze to the best of your ability. There are some extractions where I do need to place sutures after. Majority of the time I'm going to be using a gut suture, which means it is resorbable. That suture will come out on its own, usually between 5 and 8 days. Depending on why I extracted the tooth in the first place, I may or may not put the patient on antibiotics. Most extractions don't require antibiotics. If, however, you do experience fever, abnormal swelling, or the area becomes really red and you're not sure what to do, I would recommend to give us a call and we can advise you what to do. If it's after hours, we do leave our patients with an after hour number that they can call or text, which is my cell phone, and I'm always happy to take that call. Typically, the swelling is going to peak by day 2 or day 3 and start going down after that. Sometimes the swelling can be prolonged. However, if the swelling is accompanied by an onset of fever, chills, or progressively worse pain, this could be a sign of an infection. I would recommend that you call your dentist to make sure that that's not happening.